Dr. Sean from Hilton Physical Therapy, here again to present with you another video. Today we're going to be discussing hip pain, okay? So there's a couple of areas in the hip where somebody may really be experiencing pain. Two of the main areas are either in the groin or on the outside of the hip here, okay? So usually we see if it's in the groin, if there's a lot of clicking, if there's a lot of grinding, if it's really sharp pain, that's usually going to be what's called hip osteoarthritis, okay? Now if it's on the outside of the hip, usually that's not going to be from hip osteoarthritis. That's going to be what's called Trochanteric Bursitis, okay? And that's what we're going to be discussing today mainly. You may also have a combination of the both, where if you have hip osteoarthritis, you may also have, unfortunately, trochanteric bursitis at the same time. But a lot of times it just presents itself alone, where you just have that pain on the outside of your hip. I'm going to talk to you about what causes that. So I got a picture here. Okay, so to orient you guys, this is as if you're looking at the person from the front. Okay, so here you can see part of the lumbar spine, the lower back spine. Here we got the left pelvis. And here, this is actually the femur, okay? So now what we got over here is we got what's called a BURSA sac. Now this is a fluid-filled sac. And what that does is that reduces compression and friction from what may be occurring on the tendon or the muscles in that area, so that the muscles and the tendons don't get rubbed up on, and so that they maintain their integrity, okay? So this is really important. It's a nice little cushioning that we have in our body. Now the problem is that there's actually pain receptors on these fluid-filled sacs. So if there's compression on the sac from nearby soft tissue structures, that compression can signal off those pain receptors and cause pain and inflammation and things like that, okay? And it may be kind of hard to see, but I also kind of sketched out a muscle that we have in this area. This is called the gluteus medius. It's not exactly how it looks, obviously, but you guys kind of got the idea. This muscle attaches really nearby where this fluid-filled sac is, okay? Now another thing we have here is this long tendon right here. This is the longest tendon in the body. It's called the iliotibial band. I talked a little bit about that from last week's video. This iliotibial band goes down the entire length of the femur and actually attaches onto the lower leg bone of the tibia, okay? Now, when this IT band gets really, really tight, it can cause this compression on that, on this fluid-filled sac, okay, this BURSA, and that can cause that pain and inflammation and difficulty with walking. Another thing is if this muscle gets really, really tight, that can also cause that rubbing and that friction on that bursitis or that BURSA as well, okay? So now people who have this problem, they typically get it from either blunt trauma, where they fall and they land directly on that side of the hip. If you kind of feel the side of your hip, you'll feel that kind of bony prominence. That's right where that BURSA sac lies, okay? So you can imagine that's a nice prominent structure where if you land on that, that can cause a big bruise and can cause inflammation on that BURSA. Another main reason why people get that pain is from hip weakness. So you may see some people where they kind of walk like this. We call that Trendelenburg gait deviation. A lot of times we see people walking like that after they have hip replacement, where if those muscles haven't been properly rehabbed after the surgery, or sometimes as people get older and they kind of have their muscles in their hips deconditioned, they can kind of get that gait deviation. Now this kind of walk, if you can imagine, that really causes that IT band to rub up on that BURSA, and it's constantly rubbing back and forth and irritating it. And that can cause that hip bursitis. People have gotten that before from sleeping always on their one side, always putting pressure on that one side. So obviously we tell people to get off that side that hurts. Now, the biggest thing, the most important thing to do to treat this problem is to rest, okay? So you want to avoid repetitious activities that provoke that pain. So that may be, you know, if you always do a walk and your walk involves going up a hill and down a hill, that repetitious activity can cause a lot of stress in that bursa, and especially if that causes pain while you're doing that, you really want to avoid that. If you're, you know, have to go up and down stairs a lot, if there's an elevator, I really highly recommend you start using the elevator instead of having to go up and down that stairs and really causing that rubbing up against that bursa. The other thing that really tends to work, and this I find is to be the highest success of helping people with bursitis in their hip, is using a cane, especially if you've got that gait deviation, okay? If you got really weak hips, this cane can make a big difference where it's going to help to get support to that side of the hip so that you're not creating that Trendelenburg deviation, okay? You know, if you're younger and you feel a little self-conscious using a cane, you can most definitely use a crutch as well. And sometimes when we get these patients in here with this problem, with just giving them a cane and telling them to start using the cane, that problem really resolves itself within a few days or even a couple weeks at the most. So that's usually a big help. And then obviously after that pain resolves, we really want to work and strengthen those hips. So I'm going to show you guys some stretches. So because we do want to stretch the IT band and that gluteus medius muscle that I was talking about, that muscle that I showed you in that sketch, because those tendons cross right there at that bursa sac. And we also want to strengthen those muscles in that hip so that we can minimize that gait deviation and provide better support to that hip. So the first exercise I'm going to show you is called the clamshell. These THERABAND loops are awesome. These are a really great tool for strengthening the hips. They're really cheap. You can get them for a few bucks at the store. Highly recommend them. Not only for the resistance, but they give you really good biofeedback. So what I mean by that is it gives your body really good feedback when you're going through the motion of the exercise, so you can really tell when you're keying into those specific muscles. So what I'm doing is I'm just putting this band close to my knees. Lying on my side here, I got my knees bent up, I've got my feet together, and I'm just rotating my hip up, okay, keeping my feet together. Now, if you don't often do this exercise, you are going to feel it. You are most certainly going to feel it, okay? And one common mistake I see in my patients is when they're doing it, they like to rotate their whole body back. So you see what I'm doing, they're rotating their whole body back to kind of cheat. I don't want you to do that. I really want all the motion to come from the hips, not necessarily from the spine. So I would recommend probably a couple sets of 15, okay? Now, if this hurts that area, if that bursa is really inflamed, really irritated, you may not be able to do this exercise, okay? And in fact, if it's really irritated where any kind of motion really just provokes that pain, what you may need to do is you may need to get a prescription of anti-inflammatory medications from your physician, or sometimes if it's really bad, it's to get a steroid injection in that area to calm it down first so that you don't keep getting that inflammation in that spot. The next exercise I'm going to show you is actually one that I showed you in the last video too, hip abductions. So what I'm going to do is you're going to lay on your side again, and you're going to bring this leg back, the top leg back, because this is the leg we're going to work, and you're going to bring it straight up and slowly back down. Okay, just like that, you really want to make sure you're engaging those abdominals. Coming up, maybe even pausing for a moment or two, and slowly back down. And again, just like the previous exercise, if that really hurts that area, you don't want to do it. That no pain, no gain philosophy for when you're rehabbing an area of your body is not true. You don't want to push through pain. Alright guys, I'm going to show you a couple more exercises. This is going to be for stretching those tendons that attach to that area of where that bursa is, okay, so we can reduce that compression. So the first stretch I'm going to show you is called a figure 4 stretch. So this is my treatment side. I'm going to cross this leg over my opposite leg, okay? And then what I'm going to do is I'm going to grab the lower part of my leg on my left side, so the non-affected side, and pull that leg up. And you should be feeling that right around this area, okay? And we want this to be a mild stretch. We don't want this to be an intense stretch. We want it to be low intensity and longer duration. So we're going to be holding this for at least 30 seconds. So nice, mild, gentle stretch, and this should feel pretty good. So if you're doing this and you're feeling pain, back off the intensity a little bit, and if you're still getting pain, then you may not be ready for this stretch. Okay, the last stretch I'm going to show you is you're going to take your affected leg over your opposite leg and just pull across. And again, you should feel that right near where that bursa sac is, okay? Right kind of near where those tendons in your buttock attach to the side of your hip. It should be low intensity, long duration. You want to hold this for at least 30 seconds. All right, guys, and that's going to be it. The last few things I forgot to mention, I want you guys to also ice, okay? Icing is very important for this. Definitely don't put heat. If you're going to put heat on the area, you're going to make it worse. You want to use ice. 20 minutes on, multiple times a day. So ice kind of works with a cumulative effect. If you only ice the area once, it's not going to really help you too much. You're going to want to ice at least 3 or 4 times a day for 20 minutes, no longer than 20 minutes. And if it hurts while you're doing any of these things we showed you, just don't continue doing it, okay? Give us a call your physician, and we can find a program that works better for you. Okay, so this next exercise I'm going to show you is the IT band stretch. So remember that big, long tendon that runs along the side of your leg. We're going to try to stretch this tendon so that there's reduced compression on that bursa sac. So if this is the leg we're working on, where you're going to have this leg closest to the wall here, you're going to put your forearm on the wall, and you're going to kind of have your feet a good distance away from the door. What you're going to do is you're going to cross that outside leg over that leg that you're treating and leaning into it. Okay, and you're going to hold this for about 15 seconds, and you're going to do about 3 or 4 sets of these. Now this one's a little different from the stretch that I showed you last week. This one's going to target more up here where the IT band is. The one I showed you last week was for targeting more down towards the knee, okay? So again, 3 sets of 15 seconds. You need to be a little bit more limber to do this stretch. If it hurts, don't do it, okay? So next exercise I'm going to show you is crab walking. Now what this is going to do is it's going to work the lateral hip musculature on the side of your hips. Remember I told you a lot of people that have this bursitis problem, they kind of walk like this. They have a little bit of Trendelenburg gait deviation. So this is going to help to target those muscles that is causing that deviation so that we can minimize that and improve the gait mechanics so that there's not that rubbing on that bursa. So I'm going to use this THERABAND again. So what you're going to do is you're just going to take some side steps across the room. Okay, so maybe about 5 or 6 steps each direction. But what you want to focus on is you want to keep your toes pointed straight forward, okay? You also want to minimize the movement in your trunk. So you want to keep that movement in your trunk stationary. Okay? So again, 5 or 6 steps each direction. You maybe do that about 10 times. And you should be really feeling that right here on the sides of your hips. There shouldn't be any pain. If there's pain, stop the exercise. Well, thanks for watching, and we look forward to presenting another video for you guys next week. Have a good rest of your week, guys.